Hello doctors, have a beautiful day. This is Dr. Hub, a passionate doctor mentoring worldwide.
Ataxia telangectasia. So, ataxia telangectasia, it is AKA, that is also known as the Lewy-Barr syndrome. So, firstly, when we look at a disease, what type of inheritance does it have? It is nothing but autosomal recessive disorder. So, there is a defect in the AT, that is the ATM gene. So, there's a defect, that is the ATM gene, and is localized to the chromosome 11, Q22 to 23. The ATM gene is involved in the repair of the double-strand DNA breaks. So it is involved in the double-strand DNA breaks, and the defect in the DNA repair leads to a combined immunodeficiency. So it leads to a combined immunodeficiency. So the combined immunodeficiency is nothing but impaired immunoglobulin, and impaired immunoglobulin isotype switching, and it is associated with the thymic hypoplasia. Next, there is a predisposition to an increased risk of the lympho-reticular tumors. So the increase in the risk of lympho-reticular tumors, and this is example being the lymphoma as well as the leukemia. Next, what we see is the AT, that is the ataxia telangiectasia, is characterized by progressive ataxia. That is progressive ataxia. So the progressive ataxia, it is nothing but there is a beginning during the infancy, and next what we have is the telangectasia. Telangectasia is nothing but is initially on the bulbar conjunctiva, and next there is also the sinopulmonary infections, as well as the hypogonadism, and also sensitivity to the ionizing radiation and the insulin resistance. Next comes the raised alpha fetoprotein levels. So just to recap, what we saw is ataxia telangiectasia. So ataxia telangiectasia, or the Lewy-Barr syndrome, and it is nothing but what we saw is the autosomal recessive. It is a defect in the ATM gene, and it involves on the chromosome 11q22 23. And the ATM gene is involved in the repair of the double-strand DNA breaks, and the defect in the DNA repair, it leads to the combined immunodeficiency, and it is associated with the thymic hypoplasia. There's a predisposition to an increased risk of the lympho-reticular tumors, and AT is nothing but the autosomal the ataxia telangiectasia. It is characterized as the progressive ataxia, and then there's also telangiectasia, and there is sign of pulmonary infections. There's hypogonadism and sensitivity to the ionizing radiation. There's insulin resistance, as well as the increase, that is the raised alpha fetoprotein levels.